to your point, talking about practitioners, who are helping us, like, it was a practitioner who convinced me that I could have, that I was worthy of, that revision wasn't because I messed up. It was because it was a medical necessity. And there's two sides to that coin, because there are a lot of people out there who still feel like the medical necessity has to only do with complications. In that case, that's what it was. And it is that way for a lot of people. But for a lot of people, the medical necessity is weight reoccurrence, because the sleeve only gets you so far in certain cases. That was my case. And that's really one of the biggest things as far as stigma goes that I've had to deal with as a revisionist, to say the post-op is, oh, well, I thought that was only for people that had complications. What was your complication? Well, weight reoccurrence. That was it. I didn't get as far with the sleeve as I wanted to. This was an option. It was told to me by my surgeon that we go through the chronic disease talk. We go through it's never going away. It's going to try to outsmart everything we throw at it. We just have to have those tools in our tool belt to be ready to fight it. And if we don't have these conversations loudly, openly, and honestly, people are going to be blindsided like Natalie and I were. And that's just not something that I want for anybody in the community. And none of us want that. So these conversations are vitally important.
And the fact that, well, a shout out to Dr. Joe Cribbins. He's the one that's presenting with us at ASMBS. It's because he is so real and honest and open to having these casual but serious conversations with patients. It allows us, the patient, to drop that shame and stigma. I know Dr. Joe and his team work really hard on ensuring that the patient education that they have for their practice is constant. They're using patient-friendly language. They are on patient platforms, right? They're open, they're visible, and they let people know that there's nothing wrong with you. You're battling a lifelong chronic and progressive disease. And it took that conversation, I know, for you, Jason, to get on the other side of that shame and stigma. And it's just so enjoyable. It's just so awesome for me to be able to see how much more of your life is now accessible to you because you busted through that shame and stigma. You said, nope, I need to continue this treatment. It took a village. It took a lot of people, but you were able to get it done. And at this year's conference, that's exactly what we are presenting.